NIFLA exists to protect pregnancy centers across our country. And the main way that NIFLA is able to do that is to kind of help ensure that they are meeting best practice standards when it comes to offering medical services. The Ultrasound Practicum is an opportunity for RNs, NPs, PAs, physicians to come to this training and practice hands-on skills with ultrasound with the goal of trying to achieve that competency in the limited OB ultrasound skill.
For a long time, centers around the country have had trouble getting the hands-on training they need after their classroom instruction from an institute course that they go through. And so this is an opportunity for them to get a lot of scans in a short amount of time. And especially where they don't have a high volume of women coming in, because you need a lot of scans, generally in the range of 60 to 75 to be able to scan independently and pass competency. So we're going to give them a jump start on that. We feel like we have worked together to be very consistent and what will best serve the women that we're training, and so they can best serve the women, the unborn in their communities.
I started volunteering at a pregnancy center after a lady came up to me in church and asked if I would be interested, because I wasn't working as a nurse at that moment. They want to get me on board so that we can offer more hours and availability to clients. And so I'm here to learn how to do it so that we can expand the services that we offer at our pregnancy center.
So a lot of our women that came in abortion minded, we were missing that window when the ones that really we could hear in their voices needed to be seen right away. So when they hired me, they brought me on to be a daytime nurse. And with the intention, when they saw your training come up, that I could join that training. I literally signed up, I think before even my onboarding had started.
In my nursing career, I went to and helped plan and execute numerous kinds of continuing education or initial education. Well, this course, this NIFLA practicum, has the best hands-on, person-to-person kind of training that I think I've ever been a part of.
As far as the instruction, the hands-on definitely is more advanced, as well as the student to instructor ratio. I mean, usually all the classes I was in was much bigger, so just having that personal, smaller class has been very beneficial.
It's just going to be something that gives you an extra layer of that success in your pro-life movement, especially if your heart's really in it there. God's going to guide your way to really be successful in this.
This is going to help me sort of get across the finish line and be able to, I think, safely and competently do ultrasounds on babies and mamas and help to give them a better image of this little life.
So in my position, I'm always grateful when I can have a nurse give me a very clear set of pictures. And with this particular practicum of days worth of experience with sonography instructors who have had decades of experience themselves, so they know exactly how to make sure that our nurses can use the machines correctly, that they can get the right gain settings and image depth to give a quality picture for me and for the other obstetricians who do the reviews or radiologists who are helping us. And that way we can ensure that our pregnancy centers give good information to our patients and that we do not incur unusual risk from doing bad scans or having scans that we can't interpret correctly.
You know for a fact that there are different agencies out there that will do training. I want to assure you that NIFLA is well versed at what they do, that it is an investment. It definitely is an investment because it may not seem like it's something affordable for a small center, but it is an investment that will duplicate, and the value is priceless, because being able to show mom and dad the heartbeat of their baby for the first time is something that you can't really put a price on.
we've really tried to kind of take care of all the hard work for you with this program. We know that it can be a really big burden to try to get multiple nurses trained when there's so many scans that you have to achieve. So we've really worked hard to partner with host centers that have high client volume. We help them do the work to recruit the models so that you don't have to.
Hosting this was an easy yes for us for a couple of reasons. NIFLA was particularly instrumental in our founding years ago, and it just gave us a chance to kind of give back a little bit to them and enable them to provide the same benefit that we've gotten to other centers around the country. Because sometimes trying to find the quantity of models that you need for this kind of training just from your existing client base can be a challenge. I think the key is having lots of community partners, lots of churches that you can reach out to, see if they've got ladies in their congregation that are currently pregnant that would be willing to participate and support this effort in a unique way. Is very beneficial.
NIFLA would not be able to make practicums happen without the support of donors and sponsors. We thank all of those who have helped ensure that women and unborn babies around the country are receiving high-quality care. If you are interested in helping us continue this vital program, please consider partnering with us in providing ultrasound equipment and machines, funds to hire excellent instructors, or gifts for the pregnant moms who graciously allow us to scan them during our trainings. Whether you're a nurse looking for training, a center prepared to host, or a donor willing to give, your participation will equip pregnancy centers with the tools to love them both.